Hi, everyone. I'm Tina, and I'm the co-founder and CEO of Starling, a digital mental health clinic for women, starting with a focus on maternal mental health. Each year, 33 million women suffer from a mental health condition, and we are more than 2 times more likely to suffer from depression as men. Every stage of a woman's life presents her with unique mental health challenges that aren't being addressed today, driven by hormonal changes and societal pressures. Untreated maternal mental health conditions alone drive more than $14 billion of healthcare costs each year. That's $32,000 per mother-child pair. And today, 1 in 3 new mothers suffer from postpartum depression, which has more than doubled since 2019. And the sad reality is that 85% of women who suffer from postpartum depression don't receive treatment today due to a lack of access to care and stigma around these conditions. Women are waiting over 3 months to get into an in-network therapist, and 94% of those who have postpartum depression don't seek help because of the shame and guilt that they feel around these conditions. That is why we founded Starling, a digital maternal mental health clinic with community at the center. We own our specialized providers, we integrate group therapy into our care model, and we manage medication for those who need it. Our novel virtual group model achieves better outcomes. Our patients stay with us for 2 times longer, it costs us 80% less to treat them, and we have 10 times greater therapist capacity, which alleviates our therapist supply needs. Since we've started, we've served over 300 patients, and we've been able to scale our therapist team really quickly and get our patients into care within just 2 days. Our patients are highly engaged, attending 94% of their appointments. As of last month, we've acquired 92% of our patients through OB/GYN referrals. And this model is so powerful because each referring OB/GYN in our network can refer up to 30 patients per month, which equates to about 360 referrals per year from a single doctor. And we're already partnering with over 20% of private practices across Virginia, Maryland, and DC. And that's over 200 OB/GYNs in our current markets. And we've proven this channel is working. First, we have a really low CAC at just $140. We're also converting 45% of our OB referrals to paying patients, and we're building lasting relationships with our referring providers with a 90% retention rate. Most notably, this strategy has fueled over 60% patient growth month over month. And this efficient acquisition strategy and our group care delivery model drives robust unit economics, with a 50% gross margin and a 6-to-1 net LTV to CAC. Building on our go-to-market strategy, I'm really excited to share that we've recently signed contracts with 3 major health plans, including Anthem, Cigna, and CareFirst Blue Cross Blue Shield. With these 3 plans alone, we're covering over 60% of commercial lives in our current markets. And we're further expanding to New York and Texas at the start of next year, which covers an additional 10 million lives. We'll achieve 1 million in ARR by Q1 of next year. In December, we're launching medication management, and we're signing 2 additional major health plans who were already in legal review. By the start of next year, we're going to launch in New York and Texas, and we're going to secure partnerships with health systems who are already referring to us. And while we're starting with the virtual therapy and medication management offering, we're going to expand and offering more app-based interventions, offering preventative care solutions for women that are at risk. And eventually, we're going to become a comprehensive mental health care clinic for every woman. And this is just the beginning. We're starting with a $10 billion opportunity around maternal mental health, and we're going to expand into the $56 billion opportunity around women's mental health. My co-founders and I founded the company in our 2nd year at Harvard Business School, and we built a rock star team to tackle this problem. Dr. Amy was most recently the Chief Medical Officer at the Pill Club, and Dr. Crystal Clark is a leading perinatal psychiatrist in our space. We are breaking the barriers for women to get the mental health care that they deserve. Join us.